Hi, I'm Jules Tushausen, a speech pathologist of 16 years. Children can absolutely be toilet trained, even if they're not using oral words or communicating, or if their speech and language is delayed, or even if they have a diagnosis of developmental delay or autism or otherwise. The key things to look out for is if that child has some pre-toileting awareness. Okay, so what does that mean? Basically, are they aware that they're wet or that they have soiled their nappy? The best way to do this, if you don't want to just take their nappy off, there's different methods, is to put like a chucks or a wipe, just a thin one, inside their nappy. This is going to not absorb, it's not going to allow any absorption to take place. So they're going to feel whether they're wet or soiled. With nappies these days, they're so effective that when children go inside their nappy, they don't actually feel it and they can't build up that pre-toileting awareness. Again, we want to alert their sensory system. We want to pair it with language, and we also want to tie that to a routine of going to the toilet. So depending on what age your child is, I prefer for boys to be a little bit older. However, there is no clear age. It's really does come down to the parent or carer being able to read and see the signs in their child, and we're going to pair that with a trip to the toilet. So for example, if you see the child staring, they stop what they're doing and they start staring into space, or they might hide behind the couch or a chair, or once you've put your chucks in their nappy, they might go wet or take off. Or if they're not using oral words, they may try and take their nappy off or come up to you and look a bit disgruntled. So these can be signs that the child is becoming aware of the toilet. Also, if they look or watch others or show any kind of interest or awareness in the toilet at all. Again, they don't always have to have that. So if you're able to pick up on when they're going to the toilet, that's going to be a great way to then transition them into the bathroom. When they're in there, you're going to keep the same routine of pulling down their pants, sitting them onto the toilet, and having them stay there just briefly. If they have soiled their nappy, tip that into the toilet. Okay, so if there is a poop in there, make sure that the child is part of the process. So they could try and help empty it. They can definitely flush the toilet. Keep the routine though. So sitting on the toilet, emptying the nappy, and then flushing the toilet, and finally washing their hands. Remember, children have islands of predictability that help them learn. We want to keep this sequence, and it's important because we're going to pair that with visuals. There are some great toilet training books. This one's from Kmart, and you can read that together with your child. You can also create your own visuals. The biggest drawback or the biggest barrier I see is some parents say, oh, I just don't know what to use, or I want to get it right. There is no right visual. Literally take a photo of your child sat on the toilet, your child washing their hands or flushing the toilet. They're your visuals. Print them out and stick them on the wall. So we'll have a nice little sequence of what happens first, next, and last. So you can definitely start the toilet training process, become aware of when your child has soiled their nappy, take them into the bathroom, show them where their soiled nappy goes or what is meant to take place there. And eventually you'll start to see them going, like whether it be a number 1 or a number 2, and you'll transition them into the toilet immediately. Once they have that connection, they're going to start indicating to you or taking themselves off to the toilet when they need to go. Always remember, keep the flush, keep the wash hands. Even if they don't go to the toilet, you want to keep that routine and build up those islands of predictability. The brain loves repetition. It loves a routine. So keep those going, because your child's going to draw back on those as they progress with their toilet training journey. Keep asking me questions and I'm happy to answer them.